Thank you so much. It's so great to be here today talking to you about pain, my favorite topic. I know that sounds a little weird, but um, just a little plug for the IVAPM. Even if you have never heard of us, it's a great resource for pet owners, for educators, anybody for information about pet pain, as well as veterinarians who belong to the IVAPM, veterinary technicians, can find many, many resources as well. My career has been really varied. I owned a small animal practice before I moved to Arizona. And I found that halfway through, maybe when I was 10 years out, I realized that I was doing a much better job as a veterinarian if I was able to identify and reduce or eliminate my patient's pain. And that sent me on a journey to learn more about identifying and treating animal pain. And I think that this has led me to teach about 4 pain management lessons that all of us as pet owners, as trainers, as people that work with animals in shelter can and should recognize. So we're going to break this down into 4 easy pain management lessons over the next 30 minutes. Okay, number one sounds a little obvious, but number one is pets or animals, I should say, are in pain. And the reason I bring this up is because I think that veterinary medicine has a little bit of a public relations problem, because the first thing you'll hear people say, or the first thing sometimes we say is, well, there's really nothing that they're doing that could cause them to be in pain. And I like to show this video of the silly things that dogs do just to remind you and take a step back. And when you hear this discussion from people, if we were doing any of these things, we would certainly be in pain, no matter how old or young we are. Certainly me being in my mid 50s, yeah, if I do any of these things, I will certainly be in pain. And so when you hear something, or when you have this preconceived notion that animals especially dogs are not doing anything that would cause them to be in pain, remember this video, because we are certainly seeing this happen every day. And it's cute and funny, but there are things that I wouldn't dare do with my own body that they certainly do, uh, that will cause them to suffer some type of pain. And I didn't want to leave cats out of it. I pulled these off of YouTube a few years ago, and there's actually some headings called "Crazy Cat Fails," and these are posted by pet owners or cat owners that think that cats doing these things are funny or stupid or failing at what they're supposed to do. And what I find fascinating about all these videos isn't that these are cats that are failing. These are cats that are in pain. These are cats that aren't able to extend, and it's not because they're stupid or dumb. And I think that that is a really big public relations problem that we have, that we're not really identifying that these are issues that can cause, or these are exhibitions of painful behavior. So relieving pain will help them heal is number 2. And this again is a really big pain management lesson for all of us. You'll probably take some things home today that makes you take pause and think about yourself when it comes to pain as well. That whole idea, I don't like to take pain medicines. I hate to drug myself, and we're all thinking about opioids there. But certainly sometimes we are not even considering that non-steroidals like the ibuprofen that we take is a pain medication. It's to help us relieve pain. And the important reason that we do these things is not to take a whole bunch of drugs, or not to prescribe a whole bunch of drugs for animals. It's because if we relieve pain, we will heal better. And it's a bad idea not to relieve pain. And there's a simple concept about why this works. And to simplify it really easily, when we have pain, we have this response, a stress response to pain, which increases our stress hormones. That in and of itself will increase this hormonal system, renin, aldosterone, and angiotensin, which decreases our body's insulin and testosterone and creates this vicious cycle. Decreasing this and all of these factors will increase catecholamines, which are stress hormones, and the whole cycle happens again and again. That creates, if we don't break this cycle somewhere, we are going to have unalleviated pain and dire consequences. Now, this chart kind of shows you the dire consequences. It's a little complicated and a lot of little boxes here, but I can break it down pretty simply that uncontrolled pain is going to compromise our immune system, slow healing, increases complications and even death after trauma or surgery. Now, in the medical field, morbidity or mortality. So increasing morbidity or complications and making us die basically at a higher rate if we have pain. Promotes cancer and tumor growth. That's bad news. So if you are in pain and have uncontrolled pain, your cancer is going to grow faster, or the dog or cat's cancer is going to grow faster. We have changes in locomotion, respiratory, cardiac function, and importantly, and something to think about, especially in shelter medicine, is that it's affecting your mental health. Aggression, sleep patterns, anxiety, depression, these are all things that can be adversely affected by uncontrolled pain. I like this study because it's kind of a duh study. It came out about 6-7 years ago, and it was very popular in Cell magazine. There was lots of big headlines all over the news that, yeah, they found out that mice that feel less pain live longer, and that's great. This just basically says what we all have, this instinct that we know, that if we feel less pain, we live longer. But the important part of the study isn't just that. We don't want to live forever. But what they did was they removed this receptor for pain in these mice, and they found out indeed they lived a lot longer than mice that were able to feel pain. But the more important thing were the mice that weren't feeling pain and living longer were also living better. So it's not just about extended life, it's also about extended better life. So they had better hair coats, they had better weight, they were more active, they were happier. And this is a very important concept, not just that we want to live to be 100 or we want our animals to live a long time, but if they're not living a good life, that's not appropriate either. So why is this so hard to think about controlling pain? Because that's step 2, right? We want to control pain, and because that's going to help our patients. But the big problem is that there's good pain and bad pain, and good pain is not a bad thing. That's really acute pain. So here we go with this dog that runs really fast in the yard and twists its knee, or ouch, I burned myself and I touched the stove. Good pain is protective. It's mechanical reaction to either some kind of injury, a chemical or thermal or mechanical injury, and promotes this withdrawal reflex. The problem is when good pain turns to bad pain. So bad pain or pathologic pain is where the good pain turns to bad pain. It follows the same pathway, but it's persistent. So persistent tissue injury or inflammation, meaning that we don't control that good pain really well and really effectively in the beginning, will wake up C fibers, which are these long-acting fibers in the nervous system, and create persistent pain or bad pain. I almost think of it as a big symphony of activity. But the important thing to remember that it isn't just a continuation of that initial pain. There's a lot of variables that cause it to break down and make it much more difficult to control chronic pain. Anxiety, fear, stress, history, psychological things, avoidance, all of these things can create this bad pain that is much more difficult to get rid of. And what happens with bad pain is we have what's called sensitization. So we have where the pain response is exaggerated, which is called hyperalgesia. So I'm sure you've seen that in some animals where you just, they just are over the top. They you touch them and they have this horrible response. You also will see pain in areas that weren't initially painful. So this dog twists his knee and it's a problem, but now when you touch them on the back or the hip, they respond and are painful. That's called secondary hyperalgesia. And allodynia, which is even the worst one that I think. It's when you just gently do something like touching you with a feather. And if you're a human and have some type of chronic pain, people experience this all the time. They may just be doing something and somebody touches them really lightly and they have an excessive reaction to that. These are all indications of chronic pain. And we're basically the same, as fish, frogs, the lower vertebrates, the mammals, elephants, people, dolphins, skunks, cats, humans. The response to pain is basically, and the way we cope with it is basically based on the same factors, memory, genetics, and the difference is the evolution of an inhibitory pathway can help some of the upper vertebrates be able to handle pain more. The other difference is that things that we haven't quite studied in animals to the extent as in people, what kind of social and psychological factors influence the development of chronic pain. But there are some basic influences that you need to be aware of. And this is why it's hard to think about treating everybody the same way, because there are a lot of factors that are involved in taking an acute pain incident and turning it into a chronic pain incident. And one of the factors I like to talk about is this. Why do I put up this crazy husky with 2 different color eyes and this redheaded screaming child and compare it to something like this, the surfer dude Spicoli from Fast Times at Ridgemont High and the golden retriever who would probably come in to the shelter with a leg hanging off and wag its tail at you and no problems at all. The factors in development of chronic pain definitely have a lot to do with genetics. We know that genetics play a part in how our body responds and how that symphony of wind up of something acute becoming chronic can be. And it's very hard as a pet owner or a practitioner or caretaker to be able to determine the genetics and how somebody's going to respond, unless it's a husky and we know that they're going to be over the top. And if it's a golden retriever, they're not going to show us as much pain response. The other factor has to do with this, and this slide's a little busy, but the idea that not giving appropriate pain control for a procedure can cause learned behavior, which will make subsequent pain issues worse over time, has been well studied. So in this case, I have this picture of this baby. A lot of the studies were done in infants with circumcision. So the idea that it used to be similar to when we would dock the tails of puppies, veterinarians would say, oh, they're just, or when we would dehorn or disbud a cattle as calves as they were babies, we'd say, oh, their nervous system isn't fully developed yet, so they don't need pain control. I mean, can you believe we said that? We said it about babies as well. Well, they did a study, and let's talk about the babies and circumcision because it makes a lot of sense and we can extrapolate to the same studies that were done in animals. The idea that, yes, they separated babies into ones that received pain medication, topical analgesia or pain medication for circumcision compared to ones that didn't. And I think you can agree that you would guess that the ones that received analgesia had less of a pain response. The important thing about this is the learned behavior, that it wasn't just the pain response that was tampered from the circumcision. It was weeks later when they went to the pediatrician to get vaccination which group was the one that responded less favorably to the vaccine, had a bigger pain response to a simple injection. It was the group that did not have analgesia for the circumcision. That tells us that there was a change, that there was plasticity in the nervous system to make them more reactive to pain in the future. This is critical to know, so that besides genetics, historical treatment of pain is so critical for being able to prevent chronic pain phenomenon later on in life. And then the third factor in the development of chronic pain is that environmental factor. The factor of fear, anxiety, and stress can create painful consequences later on in the pet's life, in the animal's life. They looked at this in horses and published about 10 years ago, looking at stress on pain in horses and incorporating pain scales, and realizing that stress played a huge part in the response to pain in the future, and anxiety. And look at this cat. I mean, is this cat going to be more painful or less painful, or have more of a reaction, or inhibit their pain signal? And we have to realize that fear and anxiety are two different things. Sometimes when we're thinking about pain, fear can actually inhibit pain for short periods. It's not necessarily a bad thing. It's kind of like when you are running away from a bear and you're in the woods and you're running and running and running, and you are so scared that this bear is going to eat you, you don't even notice that you stabbed yourself on a stick and you're still running. And then after you escape the bear, you look down and you see the stick has punctured your leg and you have this big wound. Then all of a sudden it hurts. Anxiety is a little bit different. The hippocampus says, you know, anxiety is as we're anticipating something bad is going to happen in the future, and it can actually make the pain experience worse. Important to think about this in the context of these shelter animals or these rescue animals, in that if they come to you very anxious, if they come to you fearful, they may be hiding signs of pain because they have increased catecholamines and they're just able to block the signs of pain. But if they come to you very anxious, they may have a more intense pain experience, again, making it harder for us to treat and eliminate in the future. So remember that pain causes fear, anxiety, and stress. Fear, anxiety, and stress can also cause pain. Sometimes anxiety levels can be able to predict pain severity. And we can help to reduce pain in paying attention to fear, anxiety, and stress and doing something about it. So the idea of using fear-free techniques in practice all the time, really, really critical. And the idea of using modalities such as the calmer canine or drugs and fear-free handling to be able to better understand and prevent the potential for developing chronic pain in your patient. So Fear Free, if you haven't seen it, there's a great spectrum of fear, anxiety, and stress and ways to handle it. Green with it, looking at these animals and being able to say, okay, move forward. It's like the green light, yellow light, red light, and what you should do and how far you should go, because we want to make sure that we don't elevate to this area and create more consequences of pain that we may not be able to control. You can get these on the Fear Free website and be able to utilize them in rescue or shelters, so that everybody understands that it's very important to do this, especially from a pain management perspective. Again, if a dog is presenting and they need to be examined, proceeding slowly and making sure that you utilize some type of technique in this case to be able to handle the animal appropriately and reduce the consequences, unintended consequences of fear and anxiety, creating a more painful situation and potentially a chronic pain situation that you won't be able to control. So number 3, measuring pain helps everyone be able to fix pain. And this is very interesting because Galen, who was the first physician to really talk about this in the um, uh, 1 to 200 AD, said divine is the work of sedating pain. The nice thing that he said is that you need to really talk to your patient if you can, but you need to look and scrutinize them for clues. And he really was the first one to look at temperature, pulse, respiration, and sensitivity and facial expression. And he understood then that this was the easiest way for him to be able to evaluate his patient, was to be able to measure it, write it down, and be able to do something and see how it improved. And as veterinarians, what I do is constantly diagnosing and treating pain, and observing and measuring and testing, and thinking about what I do and coming up with a diagnosis, and then coming up with a treatment, and then assessing again. And how do we assess? We assess by collecting clues: temperature, pulse, respiration, being able to say, okay, what are these clues telling me? If the temperature's up, is our patient painful, anxious, and does he have an infection? Are they stressed out? If it's down, is there organ disease or organ failure? If the pulse is fast, is our patient in pain or shock? If it's slow, are they dying? The same for respiration. But again, using our senses, but adding a pain assessment to that typical temperature, pulse, and respiration will be really helpful as well. And it's very hard to qualify and quantify pain. I mean, looking at animals that come to us all the time, sometimes it can be very difficult. And like we said before, if we have the Irish setter or the golden retriever, it certainly can be difficult to recognize pain. And cats as well. You've all seen this in the pediatrician's office. This is something that is helpful to use in veterinary medicine. We have pain scales, which are very helpful to use, very important. And we also utilize ones that may have facial expressions, so what we call Grimace scales, which can be helpful. And familiarizing yourself with these can help you further identify pain in the animals under your care. This is an example of a horse Grimace scale, which can be helpful as well in horse rescue, being able to determine what can we see because they're really having trouble. And that brings me to step number 4. And step number 4 is you can really help us see what we as veterinarians don't see. And this is so important because animal patient survival depends upon them hiding pain. And that especially occurs with animals that may have been out on the street, animals that haven't had a lot of care in their lifetime, or had some stressful or fearful experience in the beginning. Uh, Plus, the stress of coming to the veterinarian can mask the assessment. So caretakers, pet owners, trainers, everybody, we need to facilitate the identification of behaviors that may suggest pain. And what can be helpful is to do a client questionnaire, answering when the animal is in a situation where they're most calm, in a foster situation, or finally relaxed and stress-free in a shelter. Being able to use a questionnaire to be able to identify if there are signs of pain is going to be much more helpful than having a stressful situation where the veterinarian's doing an exam and trying to evaluate. This is an example of a canine questionnaire, and there's also one for cats, painfreecats.org. Very, very helpful. And this helps to eliminate a big problem that we have, which is the shortcoming of the placebo effect. And as caregivers and as veterinarians, we have been shown to have a placebo effect. And that's not really on purpose. That's probably, we want some so badly for something to be working or something to be getting better. But up to 40% of the time, pet owners or caregivers will have a placebo effect compared to objective data of like force plate, especially with musculoskeletal illness, saying, yeah, I really think this is working. And veterinarians are horrible at it too. We're even worse than pet owners. So you'll see us try to use more objective tools like thermal imaging to be able to determine, hey, we should look at this right shoulder, something's going on, or maybe this left fore, something's going on. And also, there's new things out. This is called the pain trace, which is actually using neurologic, almost like an EEG, to be able to measure pain and baseline pain in animals to be able to determine if something's working or not. Collecting as many clues as possible, I think, is so important when we're talking about pain in our patients. So before I open it up for questions, I just think that those 4 concepts of animals being in pain, that if we treat pain, we're going to have better outcomes and better quality of life, that we need to measure pain to treat it, and that we need to use a lot of tools and observation techniques to be able to determine how best to combat the problem in our patients. Lots of information for you, being able to educate pet owners, foster parents, anybody who is working with animals about the signs and symptoms of pain in patients is critical for sure.